Welcome to Chapter 24, Helpful Hints, Complications of Pregnancy, Childbirth, and the Puerperium. This is just a medical term meaning that postpartum period. Please know that this chapter often feels a bit overwhelming for students, so please know if you end up coding for OB admissions in the real world, your employer will ensure that you are thoroughly trained at a high level of expertise. For the purposes of this course, we are going to keep our focus a bit more narrow, bit more superficial to make sure you are understanding the basics of this chapter. Let's start by discussing outcome of delivery codes. Whenever a patient delivers a baby or babies in the hospital, a code from category Z37 will be assigned. Z37 codes are used to indicate whether the delivery was a single or multiple delivery, and also whether the delivery was of a live-born or stillborn infant or infants. These Z37 codes are only used within the medical record of the mother. They are never posted to a newborn record. Z37 codes are also only used for the admission or the episode during which the delivery occurred. If a baby is delivered outside of the hospital prior to admission, so we've all heard those stories of a baby being delivered in the car on the way to the hospital, we could not use this Z37 code in that instance. It is only used when the delivery happens during the actual hospital admission. Let's take a closer look at these outcome of delivery codes. First of all, how do you find an outcome of delivery code? You begin in the alphabetic index of your CM codebook under the main term, outcome of delivery. Look at all the subterms that are available here as options. We have a single, one infant, and you can designate whether it was live-born or stillborn. We have a twins subterm, both stillborn, both live-born, or one each. And then you also have all these options for multiple births, all live-born, all stillborn, some live-born, so lots of examples. So take a few minutes this week to really understand your options here. Be sure to complete exercise 24.1 to practice these outcome of delivery, these Z37 codes. As a quick example, delivery of a single live-born infant. This would be coded to the outcome of delivery over here. Single live-born leads us to code Z37.0. When you check the tabular list, you will see a note reminding you to only use the Z37 codes on the mother's record. So in case you happen to forget, there's a little note in the tabular to remind you of that fact. Encounters for normal obstetric care or prenatal visits also include the use of a Z code. Taking a look in the alphabetic index under the main term of pregnancy, followed by the subterm supervision of, regular prenatal visits when no complications are present are coded to pregnancy supervision of normal in category Z34. Once you check the tabular, you will find options for first pregnancy versus another pregnancy. It also specifies the documented trimester within that code. So as usual, make sure you always check the tabular list once you find your code in the alphabetic index. However, I do want you to note that many pregnancies may be documented as high risk. If that's the case, please note you will not be using a Z code. Instead, we go to pregnancy supervision of high risk. All of these subterms include codes from the actual pregnancy or the OB chapter the letter O, 09 listed as the category. Many hospital encounters for deliveries are considered complicated. Take time to scan under the main term of delivery this week in your CM codebook. This is just a small portion here. There are actually several columns within the code book describing complicated deliveries. However, there are certainly those deliveries that are considered plain old normal or uncomplicated. These are coded to the code of 080. This code is found by locating the main term delivery, normal, or uncomplicated. It is important to understand all of the criteria that must be documented in order to correctly use the 080 code for a normal, uncomplicated delivery. These criteria include the following, and please remember that all of these come into play. So there's lots of things to consider when we make that final determination if we can use this 080 code. But first of all, there must be no assistance with the delivery, no instrumentation, so no forceps or vacuum assistance. There must be a cephalic presentation, meaning head first, no fetal manipulation. It must be a vaginal delivery. There must be no abnormalities in labor or delivery. No postpartum complications on the part of the mother. The outcome is only Z370, meaning single live born. Any other Z37 designation does not allow for the use of the 080 code. However, there is one little exception. If an episiotomy with repair is performed, it's okay to still consider that a normal delivery. Please note that when you do opt to use this 080 code, remember that it is always a principal diagnosis. It's always listed first. This code is explained at length in the handbook, so please spend a little time with it this week. Weeks of gestation codes, or Z3A codes, should be documented only again in the maternal record to provide additional information about the pregnancy. So this code may be found by beginning with the main term of pregnancy again, and then we find the subterm weeks of gestation. And you'll note that there is a separate Z3A code for each week of gestation. So take a few minutes and scroll through this week. It's pretty simple, and realize that often we need to pull in this code on maternal records. Let's take a look at an example from exercise 24.4 to pull in some of these concepts we just reviewed. So here we have term pregnancy, 39 weeks, delivered single stillborn, left occipito-anterior, meaning head first. These terms actually are described pretty well in the handbook, so please take a look. And then we have terminal abruptio placentae. This just means the placenta prematurely detached from the wall of the uterus, and in this case it's causing death. And then cord wrapped tightly around neck with compression. So right off the bat, we can tell that this is not going to be an 080 code right? This is not a simple, normal, uncomplicated delivery. We have a stillborn, we have complications, so we cannot use this code. So instead, we will go to the main term of delivery, complicated by abruptio placentae, which leads us to 045.9. When we check the tabular, it pulls in this last character for the third trimester. So again, checking the tabular. Then we will pull in the other complication, delivery complicated by cord around neck. So yes, these are all subterms with compression. So cord wrapped tightly around neck with compression. This leads us to code 069.1. When we check the tabular, we pull in some placeholder values because we're instructed to pull in this seventh character. In this case, this is a 0, if you can't tell. This last seventh character here pulls in items that relate to multiple gestations, but in this case, we only have one fetus, so we pull in 0, which is not applicable. We only have a single fetus. Moving along, we will then pull in the pregnancy complication code. So we have pregnancy complicated by, and this is actually a full subterm, intrauterine fetal death near term. 036.4, again, we check the tabular list. Placeholders, so we can put the seventh character in the correct place. Again, we have a single gestation when you check the tabular list. Then we talked about earlier those outcome of delivery codes. So here we will go to outcome of delivery, single, and in this case we do not have a liveborn, we have a stillborn, which leads us to code Z37.1. And then we also want to pull in that weeks of gestation code to further describe the pregnancy. So we go to pregnancy, weeks of gestation, 39 weeks, Z3A.39. Now let's focus on PCS procedures for a few minutes. In the PCS alphabetic index, let's take a look at the main term of delivery. Here you see subterms for cesarean, forceps, vacuum, manually assisted. Note that the subterms manually assisted and products of conception lead you to the same code. On the other hand, the subterms of cesarean or forceps or vacuum, those are telling you to code to the root operation of extraction. And then our body part character, when we get to extraction in this case, is products of conception, and it leads us to this 10D table. So let's remember the root operation extraction. What does this mean? This is a pulling or stripping out all or a portion of a body part by the use of force. So the use of force would be the use of the forceps or the vacuum to help assist with the delivery. So even a C-section involves pulling out using force, even if that force is manually given. Looking at the alphabetic index under the main term of extraction, because that's where it tells us to go, please note that the deliveries that you will find are listed under the subterm products of conception. Again, this will be considered your body part value, products of conception. Here you will find subterms for a classical C-section, and for those deliveries that use forceps or vacuum assistance. Let's take a look at a few examples for procedures from exercise 24.5. So our first one here, assisted spontaneous delivery. So all this is telling us is it's a regular manually assisted delivery. So we start with the main term delivery, manually assisted, leads us to our code 10E0XZZ. Second example, vaginal delivery using low forceps. So remember, we start with our main term over here of delivery, and when we use forceps, it tells us to see extraction or this table 10D0. So extraction, products of conception, low forceps, 10D0, 7Z3. And our third example, classical cesarean delivery. We'll start over here with our delivery, cesarean, C extraction, extraction, products of conception, and here is our code for a classical C-section, 10D00Z0. Again, just to reiterate, this chapter can feel a little overwhelming. So if you narrow your studies to the items we discussed in this video, you should feel pretty confident going into any quiz or exam. So happy coding. See you next time.